Good afternoon, everyone, and welcome to Global Health Intelligence's webinar on our 2021 Market Outlook for Medical Equipment in Latin America. My name is Mariana Romero Roy. I am GHI's Director of Business Development and Market Intelligence, and I will be your moderator today. Before we delve into the different trends and topics that we have planned for you today, I just want to go over a few things with you quite quickly. Firstly, our legal notice. I won't read it as to waste any time, but I do encourage all of you to do so on your own time. In a nutshell, what we state here is that everything we discuss today is based on our own research and on our own viewpoints, and that things are changing very quickly these days, so whatever we discuss might not be as valid today as it is next week. Moving forward, please. I also want to give you a little bit of background information on the company, as you may or may not be aware of who we are. So Global Health Intelligence was founded in 2014. However, we have more than 20 years experience conducting market research and market intelligence across the region. This has enabled us, as you can see on screen, not only to come up with quite unique services, but to steadily come up with publications that have been crucial for everyone doing business in the healthcare industry in Latin America. Moving forward. Now, today we have great panelists. Firstly, our very own CEO and founder, Guillaume Corpart, and Christophe Leroy, who stands as a project manager at GHI and is actually the co-leader of the medical equipment report. In terms of today's structure, we will firstly begin by going over Latin America in a global context. If you could please go to the next slide. Thank you. Then we will see and analyze the adoption of technology in Latin America's hospitals. We will also analyze the penetration of equipment. And lastly, we will see all the leading high-tech hospitals of Latin America and looking forward. Last but not least, we will have a Q&A session. Now, I'm sure everyone is by now an expert in Zooms, but for those who are not, if you go to the lower part of your screen, you will see there is a Q&A button. We encourage you to click in and please send all the questions, comments, and feedback that you may have, and we'll do our best to answer them all at the end of this webinar. Also, just so you know, this video and content will be made available to you in more or less 24 to 48 hours. We will also be having 3 poll questions throughout, for which I'll be coming back on to guide you through. As a matter of fact, before we delve into Latin America and the global healthcare context, we will start with our first poll question. Why are you interested in healthcare trends? I work in a hospital and want to see what is happening on a regional basis. I work for a technology provider and want to better understand the market. I work for a medical device and equipment company and want to be better prepared for next year. I work in a consultancy and find this is useful information, or I find this is a fascinating topic. Hopefully that'll be one of your answers, because it is quite fascinating for us too. But as you can see, we just want to understand more or less what is the motivation for you being with us today. For those of you that are just joining, please remember to click in the Q&A button, which is in the lower part of your screen, to send us all the questions, comments, and general feedback that you may have. We will have a Q&A session at the end of the webinar where we'll try to answer as many as possible. I also want to remind everyone watching that this content will be made available to you in the more or less 24 to 48 hours. Now just give it 1 second and the results are in. So most of you work for a medical device or equipment company and want to be better prepared for next year, or work at a consultancy. So those are the main questions, as well as people that work in a technology provider. Thank you so much for your feedback. Now let's go on to Guillaume, please.
Excellent. Thank you, Mariana. And I want to thank everyone here today for joining us as we present some of the highlights of our medical equipment market report And from this poll question, nearly 2/3 of our audience is joining us from medical equipment companies, many medical manufacturers, and want to have a better outlook onto the rest of this year and onto 2021, which is exactly what this report is aimed at, and some of these highlights are going to be focusing on. So thank you everyone for joining. When we look at hospitals on a global level, we really see that there's approximately 100,000 institutions worldwide. So that's a lot of healthcare institutions, and nearly 1/4 of them are in developed economies such as the United States, Canada, Europe, Japan, Australia, and many others. 1/4 of the world's hospitals are also based in China, which is huge. But what we often overlook is that nearly 1/4 of the world's hospitals are in Latin America, which is massive, and it's huge for us, and that's why Latin America is just so important on a global level when we talk about healthcare. In fact, when we make a list of the top 10 emerging markets by number of hospitals worldwide, we see that 4 of the top 10 are in Latin America, specifically Brazil, Mexico, Colombia, and Argentina. So moving on to the next slide, please. So it's not surprising to see that Latin America has a huge and very vast both hospital and healthcare infrastructure. We're talking about a market with nearly 22,000 institutions, 50,000 operating rooms, and nearly 1 million hospital beds. Now, in all of this, what is really surprising, though, is that the average hospital size in Latin America is much smaller than its counterpart in the United States or in Europe. In fact, the average Latin American hospital has just over 40 beds compared to just over 160 in the United States. So what does this mean for healthcare in Latin America? First of all, that institutions are much more fragmented than they are in other countries or in other regions. We're seeing a slew of much smaller players in Latin America, or much smaller institutions, than would be otherwise in different regions. We also see fewer hospitals with the capacity to develop as centers of expertise, to really be at the forefront of both technologies and the type of care that they're given. We also see that hospitals, because they're much smaller in size, don't have access to the same leveraging capabilities as other counterparts. And these leveraging capabilities could be either financial leveraging or it could be infrastructure leveraging. So the number of beds, for instance, plays a huge role in that. And it limits, in turn, access to capital to be able to acquire much more expensive technologies, whether that be on the IT front or on the equipment front, such as robotic surgery systems, MRIs, and the like. Okay. The exception in all of this, though, is Chile. As we'll be going into the report and looking into some of the key highlights, Chile really stands out across the region as an exception, nearly over 100 beds per institutions across the country, meaning that Chile does have access to that capital to be able to leverage institutions and be able to have much more robust and equipped institutions across the country. So moving on to the next slide. Christoph, it's a pleasure having you here with us as one of our lead project managers, but also as the lead author of the medical equipment market report that we are launching this quarter. A few months ago, the United Nations labeled Latin America as being the epicenter, or the new epicenter, I should say, of COVID. And the impact really of COVID has been felt throughout the region, both on the healthcare front, but also on the economic front. And as we travel through the months and deal with COVID on a healthcare crisis level, we really now have to brace ourselves for the economic impact of COVID. So as you were researching this report and writing it, can you tell us a little bit about some of the key areas and the key topics that you have identified in your writing that we should be exploring here and that we will be exploring here today?
Yes, absolutely. And thank you very much for the opportunity to share some of the insights from this report. What we really tried to do when we put this analysis together was to provide the context necessary to understand some of the data and the precise numbers that come in the next chapters of the report. So to start us off, I would say that there are two major aspects that any medical device company needs to take into account. One are the larger and longer term healthcare trends in the region, which obviously will inform the type of business decisions that any company investing in the region will want to take. And then, of course, we want to be sensitive to the impact of the COVID crisis and what are the short-term ramifications on a number of these business and investment decisions. As you mentioned, the crisis is putting a lot of strain on healthcare systems throughout the region. Of course, this is happening globally, but when we think about Latin America, we're expecting to see at least a 5% drop in GDP, if not more. It may yet be revised downward as we close off the year. And what that has meant right away, if we take a first conclusion, is that obviously, healthcare expenditures have been refocused on dealing with the immediate effects of the COVID crisis. So there are increases in select investments such as, well, the obvious one is equipment such as ventilators, protective gear, and other types of items that are needed just to care for all the patients that are coming with the coronavirus. What it also means, and what we've been seeing, is that there's been a drop in a number of other type of healthcare procedures, such as elective surgeries. So this has had a big impact on the balance sheet of the private sector and of hospitals, among others. And as you can imagine, we'll talk on the subsequent slides, there's also been a significant impact in the public healthcare sector. But just to get us started off, those are the first few reflections that I wanted to share.
Perfect. Thank you, Christoph. And let's move on to the next slide, because I think this is a fascinating topic. We've seen over the past few years, out-of-pocket expenditure really drop across the region. So essentially a rise either in public sector coverage or private sector insurance, resulting in a drop in out-of-pocket expenditure. But this may very well change in the coming years, or at least in 2021. So on this first slide, we have to remember that approximately 60% of all healthcare in the region is publicly funded, and that's huge. So a drop in federal revenues attributed to a drop in GDP, like you were just mentioning, Christoph, whether that be through a shrinking of VAT collections, so value-added tax collections, or a drop in employment taxes, revenue from employment taxes, will definitely cripple and lower the ability for governments to pay for and continue to fund public health care. In fact, on this topic, we've already seen in certain countries, notably in Mexico's public sector, we've already seen a contraction of procedures being conducted. Really the government putting on the brake in terms of the number of procedures that can be conducted in order to essentially save money in that regard.
Absolutely, and if I might just add to that point, there have been entire hospitals in the public sector that have been labeled and reserved to treat just patients that have COVID-19. So you can imagine the impact just at the institutional level for those that are categorized that way. And the other point I think is really salient is that it's not just to save money and cost cutting, but obviously you'll understand that this will have an impact on the type of investments that the government will make in select equipment and healthcare systems for public hospitals. So this will be a trend that will unfold at least over the next 18 months.
Right. So in that regard, Christoph, something that really stood out when I was reading the report is, we expect to see, as these budget constraints continue to evolve, an acceleration towards sub-premium products, more economical products, and generally speaking, more value-based goods within the public sector in this regard.
Absolutely, yes.
Yeah. But we have to keep in mind, and moving on to the next slide here, that private healthcare is really reserved for 15 to 20% of the population, really the wealthiest folks in Latin America have access to private healthcare. And in many countries, notably in Brazil, private healthcare is used as a way for companies to both attract and retain talent within their enterprise. So as a result of COVID and the shrinking of demand, generally speaking, massive layoffs have occurred. And that means that essentially fewer people will have access to private healthcare coverage in the coming months, or even throughout 2021 as companies recuperate their balance sheets. And for the case of hospitals, and specifically private hospitals, this is a huge part of the revenue. 80% of hospital admissions, private hospital admissions, are from folks that have private healthcare insurance. And so private hospitals are certainly feeling the impact also of this economic contraction. And this is further compounded by the fact that private healthcare patients simply don't want to go, or did not want to go, to the hospitals anymore for being afraid of getting sick within the facilities. So this has been compounded by the fact that patients did no longer want to go visit their physicians. And also all non-emergency procedures, whether they're elective or simply can be postponed because they're not emergencies, have been either canceled or pushed farther out. So private institutions have been really hit twice as hard in this regard and are really suffering. Christoph, what can you tell us a little bit about that?
Well, I'd like to make 2 points here. One is coming back to the data you mentioned on the last slide about out-of-pocket expenses. What we're likely going to see, precisely because of what you're describing, on the one hand, you have private healthcare that will see a decrease because, among others, the layoffs and people having less access to private medical plans. We've talked about the public sector also being squeezed budgetarily. And so as a result, at a macro level, we're going to see first the tapering off of the decrease that you'd been talking about in out-of-pocket expenses, and likely a rise in the short term in different countries. So that's from a sort of a high level perspective. Now, what we're also anticipating is, as you can imagine, as private healthcare institutions and hospitals will have to react and adapt to these constraints that you just described. And one area, a promising area for technology and medical device providers, is the rise of e-commerce and a number of aspects that will likely lead to evolutions in the business model. So there may be opportunities there. So among others, just to cite a few, we expect, and we're already seeing, well, obviously a lot of the sales forces of pharmaceutical firms, of medical device manufacturers, are having to do their sales efforts online. And the typical physician visit is now happening through Zoom. That's a major shift in how business is conducted. And the big question will be also, what would be the evolution of demonstrations and demos for certain devices and products? But that is one area to keep a close eye on. Another aspect that holds promise is this idea of being able to do remote servicing. So for certain spare parts and replacement of certain aspects of equipment or systems, some of this can now be done online. So that is a space that we'll also be watching closely.
Yeah, terrific. So just to recap these past 2 points, Christoph, is the economic impact is having an effect naturally on the public healthcare system, but the private healthcare system is also suffering. So we do expect to see tighter spending on both fronts in the coming years, a shift to sub-premium products, very likely also a rise of out-of-pocket expenditure from patients that are going to be paying out-of-pocket in order to access quick healthcare and quality healthcare. That's probably going to be favoring small specialized institutions, as we have seen in the past. And your third point here, which is a greater use and reliance on technology, whether that's be for servicing equipment within institutions or hospitals directly purchasing spare parts online, as well as a move from pharmaceutical and medical device companies to to move their communication and their interaction engagement platforms with physicians online, whether that be through an advanced version of Zoom like we are having here today, or something a bit more sophisticated. Something I don't want to let slip also is the rise of digital pharmacies. That's something that we've seen, one great example of which is in Mexico, a company called Pharmazone. For those of you who are not familiar with Pharmazone, many pharmacies across the region have put a lot of emphasis and great development in terms of home delivery systems. But it's really a shift from brick and mortar pharmacies to having a delivery system in place. What's unique about Pharmazone is that it was never a brick and mortar institution to begin with. It was an 100% online pharmacy that depends and relies upon many warehouses throughout the city to be able to deliver goods to patients within 20 minutes. So that's a little plug for an innovative company out there to keep an eye on. Christoph, as we look at all of this and all of these changes, and if we could move to the next slide, we have to remember that all of this is happening on the backdrop of health systems that are already being pressed. You know, Latin American healthcare systems are in a crunch, whether it be through socio-demographic shifts of the aging population or the obesity epidemic that we've been speaking about for many years. Latin America's healthcare systems are already feeling tapped, and this is just compounding and adding to that stress. When we're looking at the aging demographics specifically, we've long spoken about expecting the age group of 60-year-olds and over to triple within the next 30 years, right? And that's through heightened life expectancy, better care, better access to care, et cetera. And so that's a natural stress that's being compounded by COVID.
Absolutely. And if I just to stress that point, Guillaume, even before the pandemic, I mean, this was one of the major trends in public health across the region, and one of the main drivers of pharmaceutical and medical device investments. Obviously, in certain conditions and diseases that affect more the elderly population. But as you say, COVID-19 has come and compounded that effect, because as you well know, the elderly population is more vulnerable if they do catch the virus, and with, sadly, you know, quite unfortunate consequences. And so one of the implications here is the need and the market need for remote patient care, for remote patient monitoring, and eventually for everything that has to do with following up with patient care.
Absolutely, very good point. Something to keep in mind in all of this, and it just brings back a point that treating COVID patients for hospitals, and specifically private hospitals, is really not lucrative. Private hospitals need and depend upon physician visits, upon elective surgeries, and even upon the non-emergency procedures that have been canceled or postponed. So they need those procedures to keep thriving and keep growing. And so the reduction in all of that is really affecting the balance sheet of everyone across the board. So as we were just mentioning, and if we can move on to the next slide, please. Latin America is also facing an obesity epidemic, and that's one that has been developing for many years. We're talking about a population or region that has 25% obese population, 60% of the population being overweight. And it's hard to imagine being able to deal with, you know, massive healthcare issues like aging population, like the obesity epidemic, compounded by a situation like COVID, and thinking, how can we address all of these at the same time? And really, one cannot do that without thinking immediately of scalability, of leverageability, and the role that technology plays in growing the scale at which we can attend to patients. So Christoph, what are your thoughts on that?
Well, just like what the point about the impact of aging populations on healthcare, the problem around unhealthy lifestyles is a longer term trend. And what's happening now with the COVID crisis is that in both cases, there are a number of patients that are going untreated because they're simply not coming to hospitals. They're not coming systematically for their doctor visits. And so when we think about the role of technology, I think there are two aspects worth underlining. On the one hand, there's a role for technology to play for the delivery of care to come into the homes of patients who may no longer be coming to the institutions the way they used to. On the other hand, there's another role for technology in how best to manage those patients that do come to hospitals, whether they be private hospitals or public ones. And on this point, there's a lot of potential for telemedicine, digital applications, and the likely application of these solutions will be, on the one hand, to minimize the number of physical touch points that a patient undergoes when they do come to a hospital or to a point of care. On the other hand, these solutions will also be deployed to minimize wait times, or just simply minimize the amount of time that a patient has to be in person at a point of care. So you can imagine, well, not imagine, we're seeing applications such as the use of telemedicine to help in triage, the use of telemedicine to undertake some basic diagnostics without the patient actually having to come to the point of care. And then there's also trends in the delivery of those results through online platforms. So there's a lot going on, and these trends were already emerging before the crisis, but we believe that the advent of COVID-19 is going to accelerate these trends.
Terrific. Thank you, Christoph. And I really like how you phrased that both here and in the report, the use of technology really for two major axes. One is to reduce the number of physical touch points that the patient would have within an institution, and two, reduce the amount of time that a patient spends within the institution, henceforth reducing the risk of contagion. So thank you for those insights. Greatly appreciate it. I'll pass it back to Mariana.
Fascinating. Thank you, gentlemen. Now, before delving deeper into the technology adoption of Latin American hospitals, we will start with our second poll question, please. What do you forecast will be the impact of COVID on your business by end of year? Business is up. We are down 0 to 10% compared to last year. We are down 10 to 20% compared to last year. We are down 20 to 30% compared to last year, or we are down over 30% compared to last year. Now, hopefully, most of you will have the answer of business is up, but realistically, I don't think many people can say that. So let's see what the case is for all of you. Now, while we gather your replies, I just want to remind you that we will have all of this content available in more or less 24 to 48 hours. And for those who are just joining, if you click on the Q&A button on the lower part of your screen, then we'll be getting all the questions, comments, and general feedback that you have. We will be having a Q&A session at the end of the webinar, so we look forward to getting all of your feedback and questions. All right, now the results are back in. Unfortunately, as I expected, most of you are down over 30% compared to last year. And the other side of it is that people are down 0 to 10% compared to last year. So it's hard to have, a specific number. I guess it's different for everyone, but thank you so much again for sharing this with us. And now let's look at the technology adoption for Latin American hospitals. Thank you. Guillaume?
Yes, great. Thank you, Mariana. And thank you, everyone, for sharing those insights. This is definitely in line with what we've seen in the market with other studies, with other polls, that nearly 50% of businesses are down by at least 20% year over year. So definitely consistent with what we've seen in other studies. So when we look to analyze healthcare systems, we really look at three key elements in order to drive success within these. The first of which is the presence of medical institutions, whether these be hospitals, clinics, laboratories, diagnostic centers, or others, essentially points of care, as Christoph was mentioning. The second of which is the presence of equipment. And this can be both capital equipment as well as devices and technologies and pharmaceuticals, essentially the stuff that goes inside the institutions to be able to care for patients. And the third critical component, definitely not to be overlooked, is the presence of professional staff. Now that can be nurses, it can be physicians, it can be technicians, but essentially it's the people who enable the care for the patients. And if any of these elements, any of these three elements is lacking, the entire system really runs at a suboptimal capacity, okay? So we have to keep that in mind as we look at healthcare systems in Latin America and across the world. And we know that Latin America has a vast network of institutions. Like I mentioned in the beginning, we're talking about 22,000 hospitals across the region. And when we compare ourselves to the global standard, we're definitely above the global average. We also see that in Latin America, we're fairly well staffed. We have a high number of physicians as well as high number of nurses. Again, compared to the global average, we are up from that. But where Latin America lags, and it's a very important point, it's in the equipment. Latin American hospitals typically are less equipped than their global counterparts. And if we use the example of beds just as one example, and we'll go into other equipment in just a second, we see that Latin America is 20% below the global average. So clearly lagging a number of beds has an impact on the type of care that we're able to deliver as institutions. So in the next slide, what we explore here is the use of our database. Our database is called HospiScope, where we monitor approximately 20,000 institutions a year in terms of the number of capital equipment that they have, and the type of beds and the technologies that are used there. So we use this database to map and understand both the presence and the prevalence of capital equipment throughout the region, and we do this on a hospital by hospital basis. And by the way, for those of you who are interested, much of this information is found in our medical equipment market report that you can download. So when we analyze all of this equipment and the presence of all this equipment, we see that there are natural steps or tiers that we've highlighted in different colors here to the presence of this essential capital equipment within the hospitals. And very present, obviously, and prevalent is X-ray machines. So very basic equipment that's present in over 60% of institutions. Incubators, also very present. And as we move down these steps, we see that we get to more and more sophisticated, more and more high cost and less present equipment, all the way down to gamma cameras and robotic surgery systems. Okay. Moving on to the next slide. So we've used this model in order to develop a TechTier adoption model and an adoption system. So upon further exploration and analysis, we were able to organize all of this in the TechTier adoption model, which is presented herein. And one of the key factors, as we were alluding to earlier, is the impact of size and the impact of scale on a hospital's ability to acquire and develop further expertise, further specialization, and equipment. Christoph, when you were looking into all of this, what stood out for you as you were analyzing the TechTier adoption model?
Well, what's fascinating is that this approach to understanding the adoption of technology has to be contrasted with the fragmentation of the hospital market that you mentioned a few minutes ago. So the fact that apart from Chile, most of the region has hospitals that have a fewer number of beds than is the case in other regions has an impact on the technology adoption when we look at this model that's up here on the screen. So in a couple of slides further down, we'll look at, there are institutions that are tier 1 or tier 2 in each of the countries that we analyzed, but our conclusion would probably be that there are fewer of those institutions compared to other regions such as North America or Europe. So I think that's the biggest takeaway from a high level at looking at this model compared to how the hospital market is broken down throughout the region.
Absolutely. And I think that's a great point, Christoph, that there are level one or tier one institutions in every single market. And I think more importantly still, and you noted that well in the report, both on the public side as well as the private sector. In fact, in Mexico's public sector, we see a high presence of some very key capital equipment like robotic surgery systems, one of the reasons being that Mexico's public institutions tend to be larger and therefore have more scale and ability to acquire capital equipment. This TechTier adoption, sorry, go ahead.
Just on that point, in fact, it's quite interesting because not just in Mexico, but also in Brazil, there's some very specialized hospital institutions that are focused either on oncology or for treating heart diseases. And so some of the investment is happening in those types of institutions. And interestingly, in Mexico, some of the hospitals that have invested, for instance, in robotic equipment are the military hospitals. So those are just some of the interesting features that we find in this region.
Absolutely. Thank you for that insight, Christoph. So this TechTier adoption model, can really serve two main types of entities on the medical equipment, on the medical technology type institutions, like a lot of you here today. It can be used to help focus and target specific institutions. So we're talking about 22,000 hospitals across Latin America. Depending on your product, depending on your solution, depending on your technology, you might only want to target a handful, a couple hundred. And this enables you to focus on those specific institutions. On the flip side, for hospitals, this TechTier adoption model really serves as a roadmap for technology adoption. So asking yourself, if you're an institution, where do I go from here? I have X-ray machines, I have hemodialysis machines. Should I really be investing in an MRI or robotic surgery system, or should I be considering something a little bit more in my reach? And what we've seen is that it's very difficult for an institution to leapfrog a whole tier. The reason being that as institutions begin adopting that technology, they start learning certain key core competencies and abilities that enable them to grow in terms of sophistication. In that regard, the key competencies could very well be the IT management, so the management of electronic records, electronic imaging, amongst others, but also the HR elements, having the proper technicians on board and on staff that are able to operate this equipment and manage it correctly. So TechTier adoption model, very useful for both of those key markets moving forward. So now moving on to the next slide, and coming back to what we were discussing earlier, Christoph, about the economic impact of COVID on healthcare systems in Latin America. What can we expect to see in the coming years for equipment in general, but let's start with basic equipment.
Well, I think the general conclusion to start off is clearly hospitals and governments realize that their institutions and their points of care need to be well equipped with the basics. So we anticipate that demand will continue, but as we're facing the current crisis, there are some types of equipment that really do stand out. I think it goes without saying that investments in equipment such as ventilators will see strong growth over the next few months and into the next year, but also equipment related to patient monitoring, which is a critical need at all institutions. And likewise, elements such as sterilization and protective gear, all of the demand for that will hold up quite well.
Absolutely, Christoph, and thank you for that insight. I think that's in stark contrast to what we've seen in years past. Just for our audience here, we've actually gone and looked at the historical growth rates of ventilators in Latin America on a regional basis. And what we see is actually quite astounding. From 2017 to 2019, we saw a contraction of the number of ventilators across the region in every single country except Brazil. Brazil is the only country with a growth in terms of number of ventilators. Definitely 2020, 2021, as you mentioned, Christoph, probably a very high rebound in the number of ventilators across the region.
Well, not only that, I mean, if you see that there's just barely 100,000 units across the region, you can just see the magnitude of the problem, or put differently, the magnitude of the market opportunity.
Mm-hmm. Absolutely, absolutely. And I think in that we have to remember that for certain procedures, as you were mentioning, Christoph, at the beginning of this conversations, certain procedures that have been either postponed or canceled, not all of them will be coming back.
No.
You know, only some of them will be coming back, not all. So there's going to be an attrition of those. So it's not like, you know, everything that's been postponed will rebound all of a sudden in 2021. And that's going to affect definitely some of the specialized equipment in the market. So let's have a quick look at that on the next slide, so you can give us your thoughts, Chris, on what to expect here.
Well, I mean, the top line conclusion is that there's in generally speaking, there'll be a downward pressure on investments in high ticket items and devices. A lot of institutions, whether in the public or in the private sector, are not in a position to make significant investments in devices that are high cost, high value. There are some exceptions. You know, we believe that the most obvious one is tomography scanners, which do have a role to play in detecting the presence of COVID-19. But in other categories, the picture is quite bleak, and it may take a while before it rebounds, and before the financial and the budget situation of hospitals and public healthcare systems come back to where they were.
Absolutely, definitely the economic impact and the budget contraction, both on the public as well as on the private sector front, will impact the ability of institutions to invest in some of this capital equipment, either by moving towards lower cost equipment, more value-based, or simply just postponing certain purchases that they might have had planned for the coming months or years. Answering some of the questions that are coming up here, and I invite all of our audience to please feel free to ask away in the Q&A section. From our good friend Tay Revez, are there tier 1 equivalent hospitals, university teaching hospitals, as in Europe and in Canada? And the answer is yes, and we'll be looking at those in just a second. We'll put some examples of tier 1 institutions. Some that immediately come to mind is Fundación Bailey in Colombia, obviously Albert Einstein in Brazil. Mexico City has ABC and many others. So we'll be looking at those in just a moment as we applied our tier 1 throughout the region and pulled out some of those institutions. But certainly you can not only see them here, but through the report, be able to access the institutions that are tier 1 and also all the capital equipment that they have. So I invite you to look at that and click on that link at the end of the call. Another very good question from Jorge Juarez here. What percentage of healthcare systems are using electronic medical records versus paper records in Latin America? You know, right now the penetration of EMR, I believe, is somewhere around 10 to 15%. I'd have to double check the exact percentage. We do have it in our database, and Jorge, I certainly invite you to connect with us offline after this presentation. Shoot us an email, reach out to us. Happy to engage with you and discuss some of that. Because also, what's important here is that the EMR penetration really changes and varies by country. Okay, we see certain countries with relatively high EMR penetrations and others with a very low EMR penetration. And in fact, we did a webinar about 4 months ago specifically on telemedicine and EMR and the role of EHR, and we share those insights with the audience. So happy to connect with you offline, Jorge, and thank you for your question. Mariana, please, on to you.
Yes, thank you, Guillaume. So these bring us to the last portion of the webinar where we will be seeing the leading high-tech hospitals, and we'll also be giving you 5 megatrends for the future. But it also brings us to the last poll of this webinar. And as you can see, it's on screen. In your opinion, how will 2021 compare to 2020? Worse than 2020, same as 2020, 0 to 10% better than 2020, 10 to 20% better than 2020, 20 to 30% better than 2020, or over 30% better than 2020. Now, I think that we can all agree that the outlook is looking positive, but let's see what you all think. I also want to remind everyone that we still have time to get your questions, comments, and feedback in general. So please feel free to click on the Q&A button on the lower part of your screen and send us all the questions, comments, and feedback that you have. And for those of us that are just joining, we will be sending all of this content to you in more or less 24 to 48 hours. Now let's just give a few seconds to get everyone's feedback for this question. And I also wanted to comment that some of the questions that you've been asking, we actually have the answers in the report. And the answers are back. Most of you think that it'll be 0 to 10% better than 2020, followed by 10 to 20% and 20 to 30% better than 2020. So that's a very positive outlook. Thank you everyone for participating. Guillaume, back to you.
Thank you, Mariana, and thank you everyone for participating once again. It is indeed very difficult to imagine a year that is worse than 2020 across the board. So thank you for sharing that insight, and we certainly share your optimism and enthusiasm. I'm just going to answer one more of the questions that came through the Q&A session here. The need for disinfection and sterilization equipment used in hospitals in Latin America. This came in from Keith Kobe. So Keith, thank you for that question. Indeed, there is a strong need, in that we do see a shift in terms of the type of sterilization equipment that is used. We have some data on that in our hospital demographics database. And Keith, as I was mentioning to Jorge, or about Jorge's comment just a moment ago, we'd be happy to connect with you on that offline. Feel free to write to us and shoot us an email and connect on that. So to Tay's point just a moment ago about the presence of Tier 1 hospitals and institutions in Latin America, we've applied our TechTier adoption model to the entire database of 20,000 hospitals or so that we have. And this is just a small sample that we are sharing with you here today, a small sample of the top Tier 1 institutions across the different markets. It's certainly not all of them. Please don't get upset if your institution is not listed here. There are many others that we simply did not put on this slide for questions of space. But if you are a medical device manufacturer, medical equipment manufacturer, and looking at Tier 1 institutions, this is a good short list to start looking at. But not necessarily, your market is not only or not necessarily just Tier 1. Depending on your type of product, you might be looking at Tier 2 institutions or even Tier 3 or 4. So you really need to adapt on that, and we can certainly help with you here. These institutions, however, do stand out for leading the standard of care and for technology adoption across the region. So with that, I'm going to pass it back to you, Chris, as we move on to the next slide, please.
Well, what I'd like to emphasize is on the previous slide, even though what we see here, we've listed, so here there's 6 different countries or regions with Central America. So Central America was not listed on the previous slide, but we've also put the Tier 1 institutions for that part of the region in the report. So here you have a snapshot of the level of detail that we have provided around the Tier 1 institutions. So we've been very granular in identifying what type of capital investments they've made, This is extremely valuable information to be able to target your market and approach institutions in a very calibrated way. On this slide, we just have a sample from each one of the markets that we've analyzed. But know that in the report, there are several more institutions that are listed with the same level of granularity.
Absolutely. Thank you, Chris. And so we really dive into all of these institutions and share very specific information about them, about their capital equipment, about their presence, and prevalence of such equipment within each facility. And that's found in the medical equipment market report. So moving on to the next slide, and to wrap up the presentation portion of this webinar before we move on to answering some of your questions, we'd like to kind of recap the 5 major drivers that will be impacting healthcare in Latin America across the next year, or that will be shaping Latin American healthcare in the next couple of years, the next year or so. The first of which is what hasn't happened will be difficult to recover. And what we mean by that is procedures that have been either postponed or canceled, some of them will simply not come back. Either because patients found other solutions, either because patients don't want to go back to the hospital setting, other patients might have moved to something else altogether. So we're not going to see a recuperation one-for-one in the future, unfortunately, but there will be some attrition, that's 100% sure, and understanding that will be key to making your plans and marketing budgets for the next year. Cost cutting will remain on the forefront of the agenda, and I think we've gone into length about this with Christoph. Whether we're talking about the public sector or we're talking about the private sector, cost cutting will occur. We're seeing also certain countries, in the case of Mexico, a shift in how the public tendering system will work, being managed by a dependency of the United Nations, and therefore opening up the gamut of tenders and possibilities and competition on the tenders within the Mexican system. That will definitely also put more downward pressure on pricing. So we definitely need to have that on the top of our minds. The delivery of care will need to adapt. It will adapt slowly, as mentioned in this webinar, and it will definitely start with the private sector, but technology will play a central role in that, again, like we mentioned very clearly, in reducing the number of touch points that patients have with the institution, as well as reducing the amount of time that patients spend within the institution. Aside from the major impact of the COVID pandemic that has affected the entire world and Latin America, we also have to keep in mind the macro drivers that will play a central role in driving the needs of healthcare across Latin America, whether that be the aging population or the obesity epidemic, as well as keeping in mind that scale is a critical factor within the adoption roadmap. So it's very difficult for smaller institutions to gain the necessary scale and grow in terms of equipment. And Alejandro Infante, you asked that very poignant question at the beginning. Your very first one to ask us a question. Scale is a factor. It is more challenging for small private hospitals to be able to leverage their infrastructure, but maybe moving down the road of specialization, as well as partnerships either with larger institutions or with insurance companies, can help do that. So Mariana, on those thoughts, I will pass it back to you.
Thank you so much, Guillaume. I hope all of you have found all of this information very insightful. And if you did, then I encourage you to purchase our report, our medical equipment market report for Latin America 2020. It has a $7,500 value. However, for those that have attended today, we have a special discount code, which you can see on screen, which will give you a 30% discount if you use DSC30. You can see the link on screen, but we have also sent it in the chat, and that's where you can go ahead and find it. Now, most of you must be asking yourselves, then how do they get such unique, groundbreaking information? You know, we have talked about many actionable data points right now. And that's basically through the experience. As I mentioned, we have more than 20 years experience conducting market research and market intelligence. And we have also come up with very unique services that we can see in the next screen, please. So these are part of the service that we offer. We actually offer 4 services to date. Hospscope, which is the world's only and largest hospital demographics database focused in Latin America. We have information on over 18,000 hospitals in the region on a per hospital basis. This is a living document that only gets better, and you basically won't find this information anywhere else. It's also the case of Surgiscope, which is a database of procedure volumes across Latin America. It's also quite unique. Next slide, please. We also offer Sharescope, which some of you have been asking about information on medical devices and equipment imports. And this is precisely what we do through Sharescope, taking into consideration that more than 95% of these medical devices and equipment are being imported into Latin America, although there is an important local manufacturing, especially in Mexico and Brazil. Well, taking that into consideration, if we look at imports, then we can get amazing market size and market share analysis. And lastly, we have InScope, which basically gathers all of the 20 years that we have experience doing market research and market intelligence. If you have very specific needs, if you have a specific RFQ, then that's where we would try to help you out. Thank you very much. Next slide. And now I will open the Q&A session for everyone. Thank you so much. We've gotten great questions. And I'd like to start, Guillaume, by asking you, what kind of growth do you anticipate in Latin America's healthcare over the next year or two?
So I definitely think that it's going to be a year of contraction, for looking at least for 2021, a year of contraction still, downward pressure on costs. And this leads me to the question asked by Jose Manuel Rodriguez: what about disposable devices? What's the estimated growth? What we've seen so far from looking at the markets is a contraction in the second quarter of 2020, a contraction of between 30 and 45% quarter over quarter and year over year. So it's very consistent. This downfall as a result of COVID. And this has really been in large part driven by the fact that institutions, healthcare institutions, have cut both elective procedures as well as non-emergency procedures. And here we're talking about everything from aesthetic surgery to certain implants to others. So a major contraction. We do see a slow recuperation. So we do a hospital tracking every single week to see how procedures are moving. And we're seeing a recuperation, but it is fairly slow. We don't expect hospitals to be back on track and back operating normally until at least mid-2021. Now, obviously, there are some regional differences by country. We are seeing a little bit of a growth week over week, month over month, but certainly not anticipating anything back to pre-COVID times until middle of 2021. So that's something definitely to keep in mind and on the radars as everyone makes their plans moving forward.
Thank you, Guillaume. Are you on the same page as Guillaume, Christophe, in terms of the growth that we anticipate for Latin America, for the healthcare industry in Latin America for the next year or two?
Yeah, I think Guillaume gave a great context overall. Probably like what we're going to see is certain differentiation between certain types of devices. So things that are related to basic care and primary care and patient monitoring will be less affected than other categories. I think the devices and categories that will suffer the most are the high specialty ones and the more high cost, high capital intensive ones.
Perfect, thank you. Guillaume, what about disposable devices? What trends do you see in terms of growth for them?
Yes, I think just, again, that's to Jose Manuel Rodriguez's point. The point here is that it depends if it's a critical procedure or not. Okay, so everything that's non-critical will suffer more than what is absolutely emergency or critically driven. So, so definitely have to keep that in mind. When it comes to elective surgeries and non-emergencies, they will be postponed, they will be pushed back. They're not going to come back quite at the same rate. But we have seen also, very critical surgeries or devices and equipment that are used within these surgeries stay relatively stable. And in certain device categories, everything that Christoph mentioned earlier, from patient monitoring systems to ventilators to others, essentially the basic care type equipment has actually seen growth this year, surprisingly. So so again, a polarization of the healthcare situation in which certain products have seen sharp declines and others have seen sharp demand.
Absolutely. Thank you, Guillaume. We also have Fermina Alonso San Mejia that wants to know about the healthcare IT technologies most used in LatAm, about the drivers and the adoption of these type of technologies.
Right. So, that's a pretty broad question. When we talk about IT in general, we're going to have a special IT webinar in a couple of weeks, which Fermina, I invite you to come and join us, because there's many barriers, whether it be from the regulatory standpoint, whether it be from the budgetary standpoint, to Alejandro Infante's question at the beginning about the scale and the small hospitals, how do they access the capital to be able to make IT investments that oftentimes range in the hundreds of thousands of dollars? It's much more difficult. But where I see an immediate barrier is in the direction that government plays in terms of driving healthcare IT investments. So for instance, without the direction of certain norms and certain standards in terms of information sharing, patient interoperability, and others, it becomes very difficult for private institutions to make the investments on their own. And we have to keep in mind that patient interoperability is really where many of our institutions need to focus in order to drive efficiencies within the system. So on a high level, I would bring it back to the importance of IT in terms of scale, in terms of leveraging of healthcare systems, and in terms of driving efficiency within the system. That's where I think the greatest need will be in the years to come.
Thank you, Guillaume. Now, what about the scenario for M&A in Latin America? This is a question from Andre Caliman.
So M&As can happen at multiple levels. What's fascinating about Latin America is the level of innovation of small companies and their ability to hone in, target, and focus on very specific and real needs. One of the challenges, though, in M&A in Latin America is access to venture capital and risk capital to be able to really make these companies grow from being a great idea to being a successful disruptive concept. And we have seen growth in that, specifically in Brazil. Brazil has been very good at that. To a certain degree, Colombia and Argentina, a little bit less so in Mexico. But the point is that it really has to be a transformative process to be a very attractive solution for healthcare M&A targets to actually develop.
Thank you very much.
Yeah.
So something that we've been asked a lot, Christoph, is what other topics we have in the report. So can you share a little bit with us, aside from what we've discussed to date, what other type of information the audience can find in a report?
Yes, absolutely. I'd be happy to. So what we've done is, in addition to providing the global healthcare context through which you can appreciate some of the data that we've shared in this report, we've gone into great detail over the hospital landscape in Latin America, in the major markets, with key data around basic equipment installed and the totals thereof, and a number of other data points. We've also identified, as we mentioned during the webinar, who are the technology leaders in all of these different markets across the region. We believe this is extremely valuable data, especially for those equipment manufacturers that are targeting the Tier 1 and the Tier 2 types of institutions. And then finally, we also have done a very deep dive on the profiles of different countries in terms of the total number of hospital beds and the penetration rates around different types of the devices and technology, whether it's EMRs, PACS, REIS, and a lot of other very granular data points. And so the way we've presented it is by country. So for Peru, for Mexico, for Colombia, for Chile, for Central America, Brazil, and Argentina. And when we've analyzed the data, we've also looked at the trend between 2016 and 2019. So it's more than just a snapshot. We're really giving the direction of the market in these different categories. So we believe that'd be very valuable information for device and technology manufacturers to make business decisions and prioritize their investment dollars.
Thank you so much, Christophe. Again, we invite all of you to click on the link and purchase this report. We're a little bit over time, so Guillaume, do you have any closing statements for us?
Yeah, absolutely. More so than closing statements, I'm just going to take advantage of this to touch upon 2 points that were brought up here and in the Q&A session. The impact regarding the UNOPS regional tender for Mexico and other countries. I think that, Presidente Andrés Manuel López Obrador's movement towards reducing corruption is very noble and really stands out, especially in the healthcare space. There's just no room for corruption in our business models and business ethics, period, end of story. So calling it an entity like the United Nations to regulate tenders is definitely a strong and bold and valuable move in that direction. It will, however, change how tenders are being regulated and operated and who can participate. So all of a sudden, Mexico will no longer give preferential basis to countries that have a free trade agreement or trade agreement with its boundaries. So all of a sudden we'll have a lot more influx of products from China, from India, and from other countries that are very low cost manufacturing bases. We definitely need to keep in mind and bake into those tendering processes components of quality controls and making sure that the product is not just more economical, but also meets the quality standards that are required by our healthcare systems. And I think that's a critical point that we have to keep in mind. Mm-hmm. To a point also brought up by Tay Revez about the opportunity for secondhand equipment, there definitely is an opportunity for secondhand equipment across the region, specifically in Mexico, being so close to the United States, but also in Brazil, where Tier 1 institutions can oftentimes league their equipment to Tier 2 facilities, for instance, and so on and so forth down the chain. However, we have to keep in mind that in many institutions across the regions, public institutions are not allowed, in many countries, are not allowed to acquire secondhand equipment. They must buy OEM direct from the manufacturer equipment. So that is something to keep in mind. So while there is an opportunity, it is still a niche opportunity or limited to certain segments. So we have to keep that in mind. On that note, I know we are extended over time. It's already 1:38. I want to extend my personal thanks to everyone who participated here today. It's a pleasure interacting with everyone. I hope you found this insightful and useful, and that you will be reading our medical equipment market report for 2020 and 2021 in the near future. We definitely want to stay engaged. So on screen, you will have our contact information for each and every one of us here in this webinar, and we look forward to your thoughts and hearing from you soon. Thank you, everyone.
Thank you, Guillaume. Thank you, Christophe, and thank you, everyone, for joining us. We hope you have a wonderful afternoon, and we'll be in touch. Thank you.
you.